Okay, this is my video for survey of marketing. This is my research binder. The first section of the research binder is the vertebral subluxation complex. The next section of the binder is the wellness development section. Then we have the subluxation base care, or subluxation condition base care section. Next section is the chiropractic spinal section, the functional neurology and chiropractic section, the current mechanical systems section, and then the bad medicine, new vitalistic systems. Next binder, practice management binder. I have pre-visit, visit 1, healthcare class, report of findings, and the progressive exam. Next, we're going to move on to the initial visit. So I have my patient Daniel here. Daniel, Dr. Drew, nice to meet you.
Nice to meet you.
This is your first visit in our office, is that correct?
Yes, sir.
Okay, and looks like, based on the form you filled out here, you're having some pain in your low back and some knee pain. You want to tell me a little bit more about that?
Which first?
Let's start with the low back pain.
Low back pain. Well, that all started probably about almost a year ago now.
Okay.
And I went to a doc about it. She told me that she thinks I maybe tweaked a disc, nothing too serious, but to definitely take it easy for a while, and I did. I just I laid low. I didn't really do any sports or heavy lifting for a couple months. I would just walk around a lot, trying to just take it easy on it, and it pretty much subsided. I noticed that if I stay bent over for like more than like a minute, when I try to straighten back up, it'll definitely feel tight, kind of like a
pinching feeling, or like a kind of a dull throbbing.
Yeah, dull, more dull than anything, and
it doesn't really. Does it spread anywhere else when it's dull and throbbing, or is it mainly just it stay in the low back?
It stays like low back.
Okay.
Doesn't really go below the hip. Doesn't really go above my ribs, I would say.
Okay.
And it's all on the left side.
All on one side. Okay.
Yeah, and within the last, I'd say it went away for a while. Didn't really ever think about it for probably like half a year or so. Then this kind of segues into the knee pain because I just had this operation done on my knee, and I've been rehabbing it. And part of the rehab protocol is that I was told to start deadlifting, and that's when I started noticing it again.
Aggravating the low back.
Yeah, I would do a set of deadlifts, and I would feel fine doing it, but then afterwards I would put the weight down and then stand up, and I'd get that same dull feeling again.
Mm-hmm.
So I've had to back off of that, which isn't really helping with the knee, so they're kind of adding up now.
Okay. And then what, did you have any injuries to your knee that would cause the knee pain you're talking about? So you said
it was, I about 2 years ago, I tore my ACL and medial meniscus playing basketball, and I had an ACL reconstruction / meniscus repair arthroscopy done, and the ACL graft took, but the meniscus repair didn't take.
Okay.
And about a year and a half later, it was still bothering me. It was still swelling up. Had an MRI done, and the meniscus had actually flipped. The repair didn't take, and the meniscus had flipped. So I had to go back and get a partial meniscectomy, which I had done about 2 months ago now.
Okay.
So I'm still in the rehab portion, I guess. I still get some pain and swelling if I use it too much.
Okay.
But it's slowly but surely improving.
All right.
But now doing all this extra legwork to rehab it has been causing my low back to flare up.
Okay. All right. Yeah. So you're coming in for care. What would you like to get from the treatment here, from the care? What would you like to see change in your life?
I guess mostly just to handle the low back pain.
Okay.
I mean, other than that, just overall wellness.
Mhm.
I know that the knee rehabilitation, I kind of have an idea of what I'm doing.
Okay.
I mean, if you have any ideas, of course.
Yeah, definitely
Love
be
for you to
willing to
help
help
me
you out
with
with that.
that. Yeah.
I mean, kind of commenting on what you've been telling me, it looks like we're going to be able to help with. It seems like what you're having is kind of some muscular issues going on with using,
Mhm.
your lower extremities and strengthening up kind of your core and doing all that stuff while you're doing these deadlifts might help a little bit.
Mhm.
Because it sounds like you definitely need to be working on that knee with the surgeries and the amount of time you've had down with like just pain and things like that. So we'll definitely be working on the low back area for you, working on those muscles, and then working on getting the lumbar spine adjusted again.
Mhm.
Just a little bit to show you kind of what's possibly going on here. You got the spine. These discs down here, or the area that you're complaining about,
Mhm.
each of these discs, which it sounds like you're pretty knowledgeable about what your other chiropractor was talking about, is what's cushioning that area of the spine. And when you're deadlifting and putting a lot of pressure onto your lower body, on those legs, on that knee, you're also putting the pressure here on that lower spine. So
Mhm.
that's what's going to aggravate those, tighten those muscles up. So we're going to work on this area, adjusting here, hopefully get some of the inflammation and some of that pain settled down so you can keep up with that rehab. So
Okay.
other than that, in order to get a look at that area, we're going to have to take a couple x-rays. Probably try to take one of your knee, just see what's going on in case there's any other injury that may have happened because of the deadlifting and the rehab, but sounds like you're still getting around okay. So I don't expect to find much there, but moving on from there, we'll take some x-rays. We'll look at what we find, and then we can go from there the next time. Does that sound good?
Sounds good to me.
Okay, we'll see you next time.
Okay.
So now we're going to move on to the report of findings. So Daniel, we took the x-rays, and we got the MRI that you had from your surgery that you mentioned you had in the previous visit, and we took a look at those. It looks like the knee looks good. Looks like it's strong,
Mhm.
and the ligaments and the surgeries are holding and doing well, from my opinion. So as far as adjusting the knee and trying to do a lot with the knee, it looks like we're just gonna keep working on strengthening it, do your rehab,
Mhm.
if that sounds good to you. And then the low back, yes, we did find some issues with the disc, a little bit of swelling in the area, nothing like dehydration or degeneration of the disc, but we're definitely have some irritation starting there. So we want to just work on reducing that pain for you. We'll keep an eye on that. We'll keep monitoring that. We'll do some adjusting. It probably a couple times a week if you're having quite a bit of pain.
Mhm.
Otherwise, maybe up to like 1 day a week. We could get down to hopefully here in pretty soon. Based just on like your pain and your activity levels, just keep me up to date as if things are getting better or worse, and we'll just look at the radiographs and hopefully things get better from here. Sound
Okay.
good?
Yeah,
Okay.
that does sound good.
All right, and other also therapies that we can offer. We can do some heat and some stim possibly before you get adjusted when you come in. We could do those if you're in a lot of pain. Coming up here these next couple of weeks, if you do deadlift or something and you come in and you're in a lot of pain, just let us know. Maybe call in before your appointment.
Okay.
We could maybe get you hooked up on some stim or something beforehand, so that way the adjustment goes a little bit easier and you're not in so much pain. So
Okay.
if that sounds good. Then the next part of it is just if you wanted to get under care, we can put together a care plan for regular care, not just this acute time when you're in pain. That'll promote the wellness care side of it that you were talking about. I'm sure your other chiropractor talked about the same thing with, once we get the issue, the pain gone from the issue, then we want to make sure that that pain doesn't ever come back and that area doesn't get worse. So then, we might be looking at maybe an adjustment once every 2 weeks, once every 3 weeks, depending on what your activity level is. If you do work out hard 1 week, maybe come in, or if you're having some knee pain or something and you want to get a therapy done on your leg, of course, we can work that into the plan.
Okay.
But otherwise, cost-wise, it's mainly just going to be adjustments when you come in on the low back area, possibly some cervical adjustments, just because those are also important.
Mhm.
If you're going to hold your adjustments well in the low back area and have that knee not cause you any problems. So it won't be too expensive, and then just the therapies on top of it whenever those would be necessary for you. So
Okay.
does that sound like a good option for you?
Yeah. Well, I have a couple questions. So, to begin with, how often would you want me to come in?
I guess right now probably 2 times a week for the
Okay.
first couple weeks. It's because you said you've been having some pretty significant knee pain and some low back pain pretty regularly with working out. That way we can get things kind of squared away, get that swelling out of that disc as soon as possible.
Okay, and about how long would you say these appointments would be?
So we tend to try to have our patients in the office at maximum like a half an hour, especially if you're doing therapies and things. We don't want to keep you longer than that. If it's only an adjustment, I would say probably about 15 minutes you'd be in the office. Just come in, fill out the form that we have that you can tell me a little bit about what your pain levels are like when you first come in. We'll kind of go over and talk about how things are going for a little bit, and then we'll do the adjustment. And then you should be on your way.
Okay.
About 15 to 30 minutes.
Okay. That all sounds good.
All right. So I guess from there we just start getting to work. So it's nice to meet you, Daniel. Thanks for coming in.
Of course. I'll be back next week.
Sounds great. Have a good day.